Welcome back to TV5 News at 9, everyone. Joining us this morning is Jim Milanowski and Tarnisa Martin from Genesee Health Plan. Both of you, thank you so much for being here. How are you today?
Good, thank you.
I'm wonderful.
Beautiful. We love having you here. So today we are talking about finding local trusted sources of information, of course, when it comes to COVID-19. So first up, I'm going to actually ask you, Jim, on a local level, how is the Genesee Health Plan involved in educating the community still about COVID-19?
Well, there's so much information out there, whether it's false or real, and so people don't know where to go. And so, you know, the health plan has always been a central place for people to go for healthcare information, and so we're continuing that with working with partners in the community, other organizations that people go to and respect and trust so that they can get information and resources that they need to fight COVID. So our website at GeneseeHealthPlan.org has those community partners, those trusted voices, and how to contact them. And Tarnisa and I are involved on a weekly webinar that the Healthy Flint Research Center has hosted now for 2 years on COVID-19, and it's open to anybody out there. And so there's always information, there's always new panelists, always new speakers, and people can get the latest update on COVID-19 and what they can do.
Very good. And you know, we got to cut a lot of noise on COVID-19, the bad noise at least. So it's good to know that we have trusted local people here helping us out. Who are some of those partners involved in all of this?
Well, the Genesee County Health Department and Greater Flint Health Coalition, the Genesee Health Systems, WOW Outreach, North Flint Neighborhood Association, R.L. Jones Community Center on the north side, Hamilton Community Health Network, and I'm probably leaving somebody out, so please go to our website and they have all of our partners listed on that. But we all work together and we all try to get the same information and pass it along to everybody in the community.
And we still need that information. So Tarnisa's here with us. We call her Nurse T, which I love. So Nurse T, what should the community be doing still to stop the spread?
Well, the community should still be following the CDC guidelines and putting in safe measures. They should not rush back to get to old habits and patterns, making sure that they are still washing their hands at least 20 minutes with soap and water. And if they don't have soap and water, making sure they use hand sanitizer with at least 60% alcohol, but check the date. Social distancing, especially if you're around people and you think they may be sick, don't be afraid to ask the question, how are you feeling? Are you feeling okay? And also face masks, covering, making sure that they have masks that's covering, that's protecting themselves as well as the community. And when they're somewhere, you know, it's okay to pull out a sanitizer and wipe down stuff, making sure that you are staying protected, making sure that you're being vaccinated, making sure you're asking questions, just making sure you're doing everything you can do to protect you and your friends in the community.
Absolutely. And just to add to that, I am wiping stuff down to this day, so it certainly stuck with me since the pandemic. So Nurse T, what is the hesitancy for people to get the vaccine?
I think the hesitancy is fear.
Okay.
And there's a huge mistrust in healthcare systems. A lot of people thought that the vaccination had chips in them. A lot of people was concerned, you know, why are they now wanting everybody to get vaccinated when they didn't care about our underlying medical conditions like diabetes. A lot of people just didn't trust it. They thought that the vaccination came quick and not a lot of people had an opportunity to get the vaccination. And then a lot of people, it was some confusion maybe in the beginning, because at first some of the statements were like, this will stop you from catching COVID. Yes. And when people caught COVID and they were still vaccinated, now that created more fear. But just being able to understand that it's an extra layer of protection and that it reduces the signs and symptoms, hospitalization and death.
Well, and also I think there was like a pressure. You almost had to take a side. It almost became political. Which side are you on? Do you want to follow the CDC guidelines and other authority on this and get vaccinated, or no, I don't want to do that? And for all of us, it's just, you need to make that informed decision based on facts, and you need to have somebody that you can talk to about this. A lot of people try to make decisions without even talking to their primary care doctor,
Right.
and so we want to make sure people, that's where you should go to first on this.
So I know we've, loosened restrictions, people are traveling again. Is the pandemic done and over with?
Absolutely. I work for Hurley Medical Center, and every day we have patients come in that test positive.
Okay.
And then even the local hospitals, they're in double digits. We're seeing patients from 6 months to 89 years old. Absolutely not. The pandemic is not over.
And that's where I go to my hospital partners, and are they still seeing it? And it is, and so people might not be getting as sick as they used to, but you were talking about the way people can do precautions. As an employer, and Genesee Health Plan has about 45 employees. I don't need any downtime. I don't need staff not there, being able to work because they're sick. And even those with mild symptoms are out for 4, 5, 6, 7 days. And that impacts your workplace. And so if you could just simply follow precautions and distancing and wiping things down, we take that very seriously at the health plan, and I think it's made a difference in keeping our employees safe, and then the people who visit us from the community safe as well.
That's great. And is there anything else that we'd like our viewers to know before we go?
Just be alert. Do not think that it's over. I know a lot of times we can get naive, but don't be naive, because sometimes we are, and just don't think that it can't happen to you, because it can.
Right. Jim, anything else?
No, I just say, again, really find that credible source to get the right information from the medical community, other partners that are in the community that deal with COVID, and the resources available every day.
Very good. Thank you both for your time this morning, sharing some knowledge with our viewers. And don't forget, get your questions ready. We are going to have a Facebook talk back with these two and others today at 10 a.m. right after our 9 a.m. news. And make sure you get your questions ready about COVID-19, and if you have any questions about Genesee Health Plan.